A recent survey of 50,000 American females found 70% of respondents desired more ample or rounded breasts, and because of this, thousands of women pursue breast augmentation procedures each year to improve their body image, enhance their figure, and achieve their ideal chest size. As a female plastic surgeon, I understand all too well how self-conscious and insecure women can be concerning their breasts and how important their beauty and symmetry are, said Diane Gibby, MD, cosmetic surgeon and medical director of the Women's Center for Plastic and Reconstructive Surgery in Dallas, Texas. Women undergo plastic surgery to improve some aspects of their physical selves, but they also want to know that their surgeon cares, understands, and really listens to them. Breast augmentation is a surgical procedure to enhance the size and shape of a woman's breast. Women may choose this procedure for several reasons: to enhance their body contour, to correct a reduction in breast size after pregnancy, to balance a difference in breast size, or as a constructive technique following breast surgery. Once a woman decides on breast augmentation, the next decision is often what size implant to use. This is very important and personal choice and should be considered carefully. Some women desire a very subtle look, while others want a more dramatic contour. Studies show that the majority of women who have undergone breast augmentation are extremely pleased with the results. If there is a complaint, it is usually related to their choice of breast implant size. In fact, the leading cause of subsequent surgeries is to modify the size of the implant. The initial consultation with a plastic surgeon should provide a realistic perspective on what to expect from breast augmentation, and choosing the right implant size is a part of this process. Deciding on the right breast size is something that Dr. Gibby spends a lot of time with her patients. She stresses that the most crucial concept that women understand is that there really is no perfect breast size. Generally, there is a range that will look good for any given woman, and while cup size is something that needs to be discussed, it is really quite vague. Years of experience has garnered Dr. Gibby the knowledge that there are personal factors that need to be considered when choosing a breast implant size, as well as some dependable methods that surgeons use to help with the decision. Your lifestyle. If you are actively involved in sports, yoga, or other physical activities, the size and weight of larger implants may be a hindrance. How natural. A natural breast has a particular slope and proportion that fits your body. Many women prefer this natural look to make their implants less obvious. Other women want a more dramatic look with more spherical breasts, despite the fact that these can appear more obviously fake. You can also find a middle ground between these two aesthetics. Risk of complications. The larger your implant size, the more vulnerable you will be to certain breast implant complications. After these lifestyle factors have been reflected upon, there is several methods that can help a woman determine which size implant is the best suited for her physically and emotionally. While using photos and digital imaging to help patients choose their breast implant size can be helpful, for many women, the feeling can be just as important as the look. To truly address the issue of breast implant size, surgeons must try to help a woman choose her breast size based upon experience as well as photos and visualization. Individual anatomy must be the foundation for the implant choice. Body shape, weight, height, and size of breast prior to augmentation, amount of excess skin and sagging, and the desired breast size should all be considered when deciding on implant size. Never look at someone else's choice of implant in making your final decision. It's what you start with plus what you add, superimposing upon the shape of your own body that determines your final results. The same size implant may look completely different on another person. Formulas, standards, and comparisons may work in theory, but it is not uncommon to ask two women with exactly the same breasts what size they are, and for one to say she is a C cup while the other is positive she is a D. Breast size is often in the eye of the beholder. Also, bra cup size varies between manufacturers, styles, and how you wear your bra. Dimensional planning. The measurements of the chest wall is taken as well as the breast dimensions, including the height, width, and current dimensions of each breast can be extremely useful when choosing an implant size. Breast augmentation surgery is a very popular and effective way to safely increase the size of your breasts and change their contour. I feel strongly that within reason there is not a right or wrong size for a woman's breasts. Some women like small breasts, others medium, others extremely large, said Dr. Gibby. I allow patients to feel comfortable, relaxed, and talk freely about their concerns over their appearance without fear or embarrassment. No one has to have a breast augmentation for larger breasts, but it is a personal choice that can often improve a woman's self-image. For more information, please go to www.drgibby.com.